Hello, and welcome to Early Beginnings for Lifelong Mental Health. I'm Dr. Justine Pavlikevich. I'm a licensed clinical social worker and a mental health practitioner. I also am a professor at the City University of New York in the Human Services Department, as well as the Disability Studies and Family. I'm also a board member of Freedom from Fear. I have our website on the screen here, www.freedomfromfear.org. Freedom from Fear is a mental health and educational advocacy program, and you might want to go on Freedom from Fear to check out some of the stuff that they have on depression, because that's the topic we'll be talking about today. You can also find Freedom from Fear on Facebook as well. So let's begin. So this is workshop number 3, and we're going to be talking about depression and children. So the 5 questions we're going to be targeting today are: what is considered a depressive disorder? What are the root causes of depression? What is known about children and depression? And what is the treatment for children with depression? And why is it important that the caregiver be part of the process? So the first thing, what is a depressive disorder? So we often hear about people having the blues, or in their funk, or they're having a couple of days where they're feeling not themselves. That certainly is not depression. But if it lasts for a longer period of time, then we want to begin to say, does the person have some depressive symptoms going on? So having the blues is not necessarily depression. Clinical depression is something different. There are 2 types of depression. One is dystemia, and that's considered a low-level depression, and the other one is called major depression. So if we look at some of the symptoms for major depression, we have a lot of frequent sadness. The person might be tearful, crying sometimes for no reason, or sometimes the child doesn't know why they're crying. They also may have a decrease in some of the activities that they used to enjoy, or they may go through them, like going through the motions, but not necessarily enjoying them like they once did. There also is a sense of hopelessness, meaning that the child will begin to feel like, is this the way I'm going to feel for the rest of my life? This is what, where's the joy, where's the happiness, what is this thing that everybody talks about being happy, because I don't feel so happy. They can also have persistent boredom and a lot of low energy. They can also isolate socially, where they really don't feel like they want to do things that they used to do socially with their friends or their family, because they really don't care about engaging in them. And sometimes poor communication can also occur. One thing that can actually happen that a lot of times is low self-esteem they can have, and feelings of guilt. So also extreme sensitivity to rejection or failure, because of the low self-esteem, they're not really feeling good about themselves to begin with. They can also be irritable, have angry, or sometimes be hostile. They can have difficulty with relationships. Sometimes they can have physical illnesses like headaches and stomach aches. They may also not want to go to school, or have poor performance in school, poor concentration, and maybe there might be some changes in some eating and sleeping habits. Sometimes overeating, undereating, and sometimes the same thing with sleeping. And sometimes they maybe think about, talk of efforts to run away from home, to get away. They also may have thoughts of suicide or some kind of self-destructive behavior. What are the causes of depression? We do know that it's genetic, meaning that it can be passed on from family to family, generation to generation. Also, it could be part of the environment. When I say environment, what I mean is maybe something has happened in that child's life that is a trauma or uncomfortable. For example, maybe there was a separation or a divorce in the family, or maybe somebody passed away, or maybe there's an adjustment to a new environment. Sometimes with teens, sometimes it could be the loss of a boyfriend or girlfriend. We also know that it can be a chemical imbalance meaning that the molecules in the brain are not always talking to each other in the right way to deal with the sense of well-being and all the other chemicals in the body. So sometimes a chemical imbalance can be the root of depression. And often we see that when we look at the genetic factor too. So what is known about children and depression? About 5% of them will suffer from this disorder. They also may not mimic adult depression. Sometimes adult depression can have a lot of the sadness and wanting to be alone. Sometimes children with depression, they can have their periods of it seems like they're having fun, they're laughing, they're engaging, but it doesn't necessarily mean that inside they're not feeling depressed. So also stress and challenges can increase that risk for depression in children. Sometimes some kids say, I want to be dead, I don't want to be living anymore. So sometimes kids will clearly tell you what was going on in their minds. And sometimes if a kid is having trouble at home or in certain areas, maybe underlying there's depression. So sometimes depression can mask itself and not necessarily come out in full-fledged hopelessness, sadness, tearfulness, and things like that. So what's the treatment? We often use cognitive behavioral therapy as a first form of treatment for children. And what we're doing with cognitive behavioral is we're looking at what is the child thinking and what is the child's behaviors. And if we can change the child's thinking about certain things, because often they're thinking about negative thoughts, maybe that'll change some of their behaviors and also their emotions and the intenseness that they're feeling from the depression. We also want to tackle the anger turned inward. You hear this a lot. Now what is that? What is anger turned inward? What it is that the child has such negative feelings about themselves, the world, because nothing is pleasurable, and the low self-esteem, that sometimes the anger or negative feelings, if you will, get turned inward. So they start thinking negative about themselves. I'm no good, I'm a loser, I can't accomplish anything, I really don't want to accomplish anything. So sometimes this is all that anger turned inward. Family therapy is also especially helpful so that the family gets involved in knowing what to do for the child and themselves and understanding the illness. A psychiatric evaluation is a good thing to have. When in doubt, a psych eval is important because the psychiatrist can determine whether in fact your child has low-level depression, major depression, or maybe it's not. Maybe it's something situational that the child is experiencing and adjusting to. Antidepressant medications are also an alternative. Again, a lot of times we do not prescribe medications to children. We like to try the other therapies first before putting a child on an antidepressant. But when an antidepressant doesn't work, when the other treatments don't work, sometimes an antidepressant is tried. Hospitalizations may be part of it, not always. Hospitalizations may be part of it if your child continues to have suicidal thoughts or it seems to cannot get out of their depressive states, and it tends to immobilize them, and where they're really quiet, they're not getting out of bed, they're not talking. So sometimes hospitalizations could be very helpful. So why is it important for you to be part of this process? Because sometimes you're the first one to notice and you can monitor some of these symptoms. Maybe the child will also disclose to you some feelings and feel that they're being taken seriously if you've been discussing their depressive disorder or symptoms with them. Sometimes depression can make a child feel extremely alone. That's part of the depression. It wants the child to feel totally alone. So by you being part of it can help with that process. You can also help in the aiding of the daily routine, because sometimes what happens with depression, a person will feel like they're a robot. And okay, I've got to get up, I got to take a shower, I got to brush my teeth, I got to eat breakfast. And sometimes you can be that kind of person that helps that child to begin to do the daily routines and not miss them. Also, you can initiate doing activities together with them. So sometimes kids will need a little bit of a push. But also, if you know your child and you know the depression well enough, you'll know when not to push and when to push, okay? You can also initiate some of the ongoing evaluations with the professionals, the mental health professionals. So sometimes if you see something, you can say, you know what, I think I want to call the therapist, or I think I want to call the psychiatrist, and just let them know what's happening. You can also speak to others that the child may interact with, so they get to understand why your child is acting in a certain way or why behaviors are occurring within your child. And also, a caretaker's role is to be involved when a child is sick, and depression is certainly, a sickness. One of the important things is you can save the child's life, especially if they're having some suicidal thoughts. And there's greater success for remission if you certainly are involved. So how can you assist? You can do some work at home. So ask yourself, is a professional evaluation needed for your child regarding some of the depressive symptoms? Yes? No? Why not? Okay? And I also want you to read the government handout on mental illness in children from the National Institute of Mental Health. They can give you really some great ideas and look at depression a little further. So, until I see you in the next workshop, all the best to you and your family.